So here's the epidural space. Here's the tail of the spinal cord, so the equina, okay? And then the the dura is right here. Sometimes it's kind of hard to see, but that's the dura. So you got spinal fluid in here. You have the tail or nerve roots from the spinal cord that ends up here. And so this is an epidural needle here, this thicker one. You can see how much thicker it is. This is a spinal needle. Spinal needle is much thinner because we don't want to create a big puncture in the spinal sac. And that's why if an epidural inadvertently punctures the spinal sac, that she can develop a headache from spinal fluid leaking every time she stands up. Okay, so why would we do both? They don't always do both, but if this is a combined one. And the reason for that is what goes into the spinal sac acts immediately. Okay, it's a pretty immediate response. Mom has relief. Whereas the epidural takes about 20 minutes for it to be absorbed into the nerves that are in that area, kind of bathe them and have them numb from the top of the belly down. The anesthesiologist wants that catheter to stay in place. They do not want that moving. And we tell mom to roll in bed, don't scooch. Okay, did we miss anything else? Yeah, we kind of did. Wow, it really skipped here. Okay, so that's okay. I want you to see that this is the spinal cord. You can see the solid spinal cord here, and then you can see where it starts splitting into nerve roots. And then the epidural catheter is placed down here outside the spinal sac. The catheter is threaded in, okay? And then it's taped here and taped up her back. Cesarean section, we're almost done. Okay, the reasons for a cesarean section. This is not all the reasons by any means. These are just a few reasons. So if the baby is in a position where the baby is not going to be coming out, is a transverse position. If we have a breech position, the feet or the bottom is presenting, because the head would be the last thing to come out and it's the hardest, least pliable thing to come out. So we want the head to come out first. The rest can pretty much follow. Placenta abruptio. This is where the placenta starts detaching from the uterine wall and mom can hemorrhage. Got to get mom into a C-section and get that baby out quickly. And placenta previa, where the placenta is implanted down low in the uterus, and the placenta needs to stay attached until the baby is out. So this would be another reason that mom might need a cesarean section. Any fetal distress that we can't cure that gets worse, any maternal medical condition, or any emergency. And we'll talk more about that in complications. Nursing care and safety for the OB patient. This is important, you guys. So confirm the time of the last meal. Aspiration, again, is a big concern with this patient. Administer an antacid. Now, if this patient was a scheduled C-section, obviously she's been NPO, but we administer an antacid to neutralize the stomach acids, because if she aspirates stomach acid, it can be very damaging to the lungs. So we give her an antacid, some sodium citrate. Everybody gets this, and they just kind of chug-a-lug it. Position the patient on the table. Place a hip wedge under mom's right hip to prevent vena cava compression, so that supine hypotension that can occur. So when we place that hip wedge under her right hip, she's a little off-centered, and it just helps with perfusion to the uterus. And then we place a grounding pad on her leg, because we're going to be using electrocautery, a warm blanket over her legs. That's helpful. And we take the FHTs right before the abdominal scrub. Okay. All right. And this just shows you different types of incisions. Now, this is a uterus here. This is the abdomen out here. And this is the uterine incision from the skin. But in just considering the uterus, there's another incision. You know, you get through the skin, and then you get down to the muscle, and then you get to the uterus, and there's another incision, how it's done, and also maybe how it was done the last time. This is important for the physician to see, because A transverse incision heals faster, but a vertical one is typically, sometimes an emergency situation, it allows for quicker access to baby. And this is a picture of a uterus that they actually sometimes do this. They take it out to repair it because they can visualize everything better. When they go into the uterus, let me just back up a moment here. When they go into the uterus, that's very fast. It's like maybe 8 minutes or so, and they get the baby pretty rapidly out. It's the suturing afterwards that takes 45 minutes, depending on how fast the physician is. But when they suture it afterwards, they oftentimes will take the uterus out, put it on the abdomen, repair it, and then return it. I want you to see this here too. This is the fallopian tubes, okay? Okay, and then we have staples in the incision after delivery, and we have 1 year after that, we just have a minor scar there, okay? Okay, that's it for C-section and pain during labor and pain relief during labor. Okay, everybody, see you next round.